Minister. Then we go over to Dr. Myanna Charles for a look at the general COVID-19 situation in Grenada. Minister Steele, good morning to you.
Good morning, Philomena. Good morning to all of your viewers and listeners, members of the media, all. This morning, again, regrettably, we have lost more Grenadians, and first and foremost, I want to extend my condolences and ask us all to keep them in our thoughts and prayers as we move forward. We have the figures and updates will be given by Dr. Myanna Charles and Dr. Shawn Charles. I just want to give an update specific to yesterday. We had a delegation from Mexico arrive here. These are ICU doctors and nurses who, as we speak, should be proceeding to our general hospital as they have cleared their PCR testing and quarantine to assist or to give us much needed assistance in our COVID ICU wards. We also have a delegation of members of our own diaspora led by Dr. Philip Bonaparte, a son of the soil, who has come here with a three-man team to also lend assistance. We have others that are coming, but those are the ones that are on island as we proceed, and it's much needed relief for our doctors. Some of these individuals have been going to all of the other hotspots as they have shown up to render assistance, as would be the Pan American Health and our own regional policies as well, rendering assistance where we did so with St. Kitts from a security standpoint, and will continue to assist and receive assistance wherever needed. So I want to thank them. And having said that, also I'm sure many of you have heard of the announcements made by St. George's University, which is that St. George's University will be moving away from in-person classroom teaching for the next 2 weeks. They are doing this just out of an abundance of caution, and because we need to recognize that a significant number of their students, whether Grenadian or non-Grenadian, live in the very communities that are experiencing our outbreak right now. Thankfully, their student body is fully vaccinated, so the very small numbers of their community that are testing positive are testing so with very mild symptoms, if any at all. But out of an abundance of caution, they have also notified all of their team members that they're moving away from in classroom teaching. I do hope that this measure, like all of our other measures, that will only be needed for the next 14 days. You would have seen the Gazette. We are continuing our measures. In essence, it is the same that we have gone through for the last 14 days up to this weekend, save and except one change, which is the hours that persons are allowed to utilize our beaches and rivers has been extended to 1 p.m. in the day instead of 10. But there are still no movement weekends, the next 2 weekends. The curfew during the week remains the same, 7 to 5, and the no movement weekends start from 5 p.m. on Fridays. Everything else, in essence, is the same as we have experienced in the last 2 weeks. Our team does hope, as well as the cabinet, and I'm sure most, if not all of us as Grenadians, hope that this would be the last 2 weeks that this would be necessary. The team here will explain, based on the information and the tracking, what are some of the determinants that will lead us to a decision of further or no more restrictions. We do need to get past this. We do need to get vaccinated. There is now, not just worldwide as there has been, there is now local empirical data, undeniable data that shows the effectiveness of vaccinations that will be shared with you today and can be verified by each and every member of the public and the media. I encourage members of the media to verify and assist with this. It is only through vaccinations that we will get through this truly. We will keep fighting and put up our best fight. And I want to end by saying that I really would like to thank all our frontline members for their continued sacrifice and human service in keeping us as healthy as possible, as safe as possible under these most difficult times. Thank you.
Thank you very much, Minister Steele. We'll go straight over to Dr. Myanna Charles, who will give us a look at the epidemiological situation that currently exists in Grenada, Carriacou, and PT Martinique. Dr. Charles, go right ahead.
Thank you, and a pleasant good morning to the listening and viewing audience and media representatives. By way of an update, Grenada has recorded 4,213 confirmed cases of COVID-19, of which 1,813 have recovered, and 2,337 are active. Now, of the active cases, 9 are imported and 2,328 are local. Now, let's just look at a breakdown of the active cases. 53% are females and 47% are males, and the age range is 2 months to 103 years old. As it relates to the vaccination status of the active cases, 85% are not vaccinated, 10% are fully vaccinated, and 5% have received their first dose of either AstraZeneca or Pfizer. And again, cases are dispersed throughout the mainland and Carriacou and PT Martinique. Grenada has recorded 63 cumulative deaths, with the 48 occurring in the hospital and the rest in the community. At this point, I would like to extend my deepest sympathy and condolences to the family and friends of the deceased during this difficult period. We are here with you, and I just want to encourage you to keep the faith up, because we will get through this phase. The age of the deceased ranged from 18 to 103, and important to note, 97% of the deaths were not vaccinated, right? 97%. So again, we see that vaccination works. Remember, the vaccines are here, it prevents severe illness, it prevents hospitalization, and it prevents deaths. I would like to repeat this again, 97% of persons were not vaccinated. So again, I encourage persons to go out there and get vaccinated. Just to give an update as to the hospitalized cases, currently we have 79 patients admitted to hospital. 55 of those are admitted at the General Hospital, 11 at Princess Alice Hospital, 3 at Princess Royal Hospital, and 10 at Monkey. There are currently 2,337 persons in isolation and 342 persons in quarantine facilities throughout the island. As it relates to the vaccine uptake, to date, we have administered 54,175 vaccine doses. And since the rollout of Pfizer on August 23rd, we have since administered 10,773 Pfizer doses. Now, to further elaborate, 32,467 persons have received their first dose, and 21,708 are considered as fully vaccinated. As it relates to the percentage of the population that is vaccinated, now the percent of our eligible persons, so these are the persons who are eligible for vaccination, that is individuals 12 and over, 23% are fully vaccinated. To date, we have conducted 67,183 RT-PCR tests. Now, last weekend, the Ministry of Health, in collaboration with a number of volunteers, conducted vaccination and COVID-19 testing at a number of locations throughout Grenada. And, that drive touched each parish. It was successful, and it gave us a picture of what is happening in our communities as it relates to COVID-19 infection rates. Now, over the weekend, we administered 1,390 vaccine doses, which is an increase from the previous weekend, where we administered 507 doses. And we conducted 2,174 rapid antigen tests, as well as 971 PCR tests. Now, the overall positivity rate over the weekend, we saw a decline, right? And it is now 18.6%. Now, the Chief Medical Officer will will talk a bit more about this, but this is encouraging, right? And it shows that we are in the right direction, but also, more importantly, it shows that persons have their guard up, right? We see that the messages are getting through to people. You know, more people are coming out here to get vaccinated. More people are wearing their masks and practicing those preventative measures. And this is not a time for us to let our guard down. In fact, this is a time for us to more than ever keep our guards up, because we want to see that positivity rate continue to decline. Now, at this point, I would like to recognize all the hard-working volunteers and all our healthcare providers, including the private physicians, right, who came out over the weekend at the pop-up sites, who were there vaccinating, testing, encouraging persons to get vaccinated, educating persons, and even providing medical assistance, right? We say thank you to everyone. And this is our fight. We are in this fight together against COVID-19, right? And we will only get through this united. So again, thank you.
Thank you very much, Dr. Myanna Charles, and we go straight over to the other Dr. Charles, the Acting Chief Medical Officer. Dr. Charles?
All right, good morning. Good morning to my fellow panelists, to the media, and to the public at large. Once again, we are here just basically giving an update as the situation of the outbreak here in Grenada progresses. Firstly, let me say our heart goes out to all of the persons who are hurting right now as a result of a loss of a loved one due to this dreaded disease. And for all those families who are awaiting anxiously because they have family members right now who are admitted in the hospitals and they do not know which way things will turn. We just want to say, keep the faith, continue to practice the measures that we have been preaching for a very long time in order to avoid further persons falling victim to this very deadly disease. So we continue to monitor the progress of this outbreak here locally, and we continue to observe anxiously the progression of, or let's say the progression of the data as everything unfolds. About 2 or so weeks ago, we reported that from testing we saw a positivity. Right, we saw the positivity rate hovering, averaging around 30%. It means that from all the testing that we are doing, about 30% of persons were coming up positive, which was around 1 in 3. Now we note that this is an extremely contagious disease. So when you have about 1 in 3 in your population turning up positive from testing, and we know that these individuals all have families, they have jobs, they have lives, they have churches, then we recognize that we were in a situation where we could have, the greater part of the population infected in no time. All right. From our testing over the past days, we are seeing some signs that positivity rate is going down. At least on the 18th, we had an average positivity around 23%, and on the 19th, we had an overall around 14%. So over that weekend, about 18.2% of all the persons who were tested, and we did quite a number of tests. Dr. Myanna mentioned the number a short while ago. And overall, we saw that about 18% of persons who came out to get tested were positive. It is an encouraging sign. It is an encouraging sign, but it is one that we look at anxiously, and we analyze carefully, because one, we have increased significantly the number of tests that we're doing, so we are testing more individuals. Secondly, we recognize that given that this is a very infectious disease, many persons may have already been infected and recovered. And after testing now, these individuals will turn up negative. So it's still very early, and we continue to look on carefully. We know that we are seeing better adoption of the recommendations, the wearing of the masks and sanitizing and all of that. And of course, the measures that the government has put in place are also starting to bear some fruit, but it is not a time to be complacent. Now, we've had 2 weekends of no movement, and one of the objectives or 2 of the objectives of these weekends was, one, we wanted persons to come out again and get tested, and we wanted persons to come out and get vaccinated. We tried to make, in many instances, vaccination and testing available as close as possible to the communities where persons live. So we've had several outreach efforts targeting different neighborhoods, and these are going to continue. During the first weekend, we vaccinated a total of 507 persons, and out of that, importantly, 467 more persons will receive their first dose of the vaccine, and 40 received their second. In the second weekend, which is the one that just passed, the 18th to the 19th, we vaccinated a total of 1,390 individuals. So we are seeing a healthy uptick in vaccination. And importantly, first doses, 1,191 individuals came out and get their first dose of the vaccine. So we see that the message is getting out there to many individuals. And 199, their second. All right. So our vaccination rate as a population is increasing. Of course, we would like that rate to go up at a faster rate because we don't have time. Right now, we are out of time. We are out of time to protect the people that we are trying to protect. And it will be desirable that they all come forward to get vaccinated immediately. We see that fully vaccinated in the population, we are only at 19%. That means only 19% of the total population so far has received their first and second dose of the vaccine. And we have 9.5% that are partially vaccinated. So we still have a little way to go. What we have been observing, persons are recovering and returning to work. That initial shock, that initial anxiety, we are working our way through it. But of course, things can still get worse. If you are observant, you would realize that there are many countries right around us now who have had wave after wave after wave. They're going into another wave. All right, they are going into another wave. So we have already proven that we are not different, and that we can fall victim to the same circumstance as everyone else. So we need to continue, right? We need to continue. We are nowhere near to the end of this, all right? We are nowhere near to the end of this. We still have some ways to go. We still have a large population of vulnerable, unvaccinated, at-risk individuals in our communities. All right? These individuals are elderly, or they may be age 50 and above, 60, 65 and above. They have multiple chronic diseases, some of which are not controlled. They are still undecided about getting vaccinated. they are still being discouraged by others to not take the vaccines, and for all the wrong reasons. All right, they're being filled with misinformation, and they're being discouraged from getting vaccinated. And the thing is, they're falling victim one by one. All right, we get the calls, and we see the outcomes. All right, so we still have a lot of work to do. All right, we still have a lot of work to do. And I hope that because it's becoming evident that this disease is going to touch at least everyone. Soon everyone is going to know someone close, that has suffered severely from this disease. I already know a few, all right, and it's a few too many. So we still have a lot of work to do. There are still some areas of concern. We still see persons gathering in some locations with no distancing and no mask. A personal observation I have made is that there are some popular rum shops or liming areas, liming spots, where there are a number of young and middle-aged men and a few women in between them. They can be seen sitting and behaving as if nothing has happened. All right? The proprietors of these establishments seem to have a high tolerance for having these persons gather, not wear masks, and just living it up. And then these individuals return to their families, and they carry the disease with them, and they pass it on to persons who are frail, and then they go on to suffer the severe consequences. It is a very irresponsible thing to see. And sometimes even after curfew hours, you still see some popular rum shops with gatherings. This is not a joke. This is not something to be taken lightly. All right, so we encourage these individuals, they're adults, we encourage them to be more responsible. All right, we should not be seeing large gatherings outside of rum shops of persons not wearing masks, not distancing. All right, this is a very irresponsible way to behave. We hear often of persons who test positive. They're instructed to isolate, and they refuse to do so. They go about in the communities, and they endanger the lives of everyone. This is a very selfish way to behave. You are a very selfish individual if you are doing this, and you are putting others' lives at risk. So we ask you to stop. If you're asked to isolate, you go home and you isolate for the period that is indicated. And yet we still have others who are frankly denying the existence of COVID altogether. I am not sure what it will take to convince these individuals. Maybe only the Almighty will be able to. But at this stage, it is frankly shocking that we have to stop and try and persuade individuals that COVID is real. All right? There is a lot of information. There's too much information, frankly, out there for persons to adopt that demeanor at this point. And there, of course, there are individuals who are denying at all cost when they test positive that they have COVID. They completely refuse to accept the diagnosis or the test result that they have tested positive for COVID. And as such, they go about, they move around in the community, and they spread the disease. All right, they spread it to others. And then the disease can reach the vulnerable. All right, all of this needs to stop. Of course, the work continues. On our end, the work continues. We salute the volunteers. We have witnessed recently an outpouring of support. Volunteers, both local, regional, from near and far. All right, we have individuals that are coming out to assist us at our testing and vaccination sites. We have persons who have donated supplies. And we are very encouraged by this, because community spirit is what is going to get us out of this mess that we're in. It's each one doing their little part that is going to help the country in general get out of the situation that we are in. Of course, we've received some colleagues, a medical team from Mexico and the US, from our diaspora, and we are very thankful. We are very thankful. We accept all of the assistance that we are given, because that way, helping a brother out is one of the ways in which that we lift each other out of a tough situation when they present. So I want to continue to encourage this kind of community spirit. I want to continue to encourage persons to come out, get vaccinated. All right, if you've been exposed, get tested, isolate, quarantine. Just do what you need to do, and we will all get out of this situation in short order. Thank you.
Thank you very much, Dr. Charles. The areas of concern that were highlighted are in fact quite concerning. Sure that we can all play a part in helping to address those areas of concerns. We may very well know someone who is engaging in the practices and should discourage them from such behavior as it affects us as a country, us as a people. It is now time to open the floor to questions. Members of the media, I see we have Callistra Faria here. First in line, Callistra, you may go ahead.
Good morning. Thank you very much, Philomena. One of my first questions, I actually just got a phone call from someone who wants to find out, to get a better breakdown of the vaccination, the number of persons treated. They are reading the numbers as over 50,000 Grenadians have at least had a jab. So can any of the doctors give a more precise breakdown of how many people have had their first dose and how many people have had both doses? Also, the rum shop issue, yeah, that's a real problem. I don't understand why it's not being enforced any better. Given the situation we are in, is the Ministry of Health considering shutting down all rum shops in the country at the moment? Because I'm not sure the cost-benefit analysis is making sense in terms of the economics for the shop owners who are putting everybody at risk. It is really out of control. So will the minister take some decisive action against that? And the people who have been breaching isolation, Dr. Charles, do you have specifics on these people and what was done about it? As the Public Health Act gives the power to move, have you moved on those people?
Thank you for your questions, Callistra. Dr. Myanna Charles will start the responses.
By means of clarity, we have administered over 50,000 doses, right? And for the breakdown, now of those 50,000 doses we have administered, over 32,000 have received their first dose and over 21,000 have received their second dose. Now, if you were to look at these numbers closely, that means that 21,708 persons are fully vaccinated, right? You have to subtract that from the persons who have received their first dose, right? So 10,759 persons are counted as partially vaccinated, have received either their first dose of Pfizer or AstraZeneca.
Yeah, Calistro, on that point of the rum shops, remember most of our rum shops are also the places that people buy food as well. So it's not a case of closing down rum shops. I've said last week, and I'll repeat again this week, to truly prevent community spread, we have to change our community habits. This is not something that we can pass laws to get ourselves out of. And this is not something that we can just close off the country and get ourselves out of. We were able to do that when we were stopping cluster outbreaks or so. But once you have community spread, it is the community habits, the community itself that has to adjust in order to stop this. And we are seeing many persons in the community making that positive difference. But yes, regrettably, as Dr. Charles said, and as you are saying, I'm assuming because you're seeing it yourself too, there are some that are not making those community adjustments and continue to put us and those that we care for that are vulnerable at risk. So it's not something to say shut down all the rum shops, because they also provide food.
All right. With regard to the question on specifics, I do not have the specifics that you may want or require. But let me just say this. This is an area that is very difficult to enforce, and especially at a time when your resources are strained. It is very difficult to reach into every small community and identify each individual that has tested positive or that was expected to quarantine, and that individual is not obeying. A lot of the times I know at least the authorities in charge of enforcement, they rely on reports from the community to identify these individuals, because ordinarily it's very difficult to identify them. So it will take a community to identify these individuals and make the report, and so that enforcement action can be taken. But there is another layer of complexity, because a lot of the times the community does not know that these individuals were positive. So it will take the family, who are the ones who may know that, listen, my son or my daughter or my brother or my sister was given a positive diagnosis, because a lot of the times within families, they know, they share information. So it will take a family member to call and say, listen, my brother was given he got a positive test, but he's not staying home. So you see how complex the situation is, and not many families are prepared to do that. So that all of those situations are what complicating the enforcement of this. And that is why we have been preaching personal responsibility from the start. That is the only way we're going to get out of this. You cannot enforce your way, or have a law for every action that an individual to ensure that you get compliance from an individual. I don't know what society you will have where you have such a level of pressure on daily activities. But I say all of this to say that it is a complex issue, and it's one where it is only if the individual takes some level of personal responsibility for protecting himself, his family, and his community. That's the only way I believe we're going to get around this situation.
Thank you, Dr. Charles. Next, we have questions from Nancy McGuire. Nancy, good morning to you.
Good morning, and good morning to everyone. I wanted to find out more about you said that 48 of the deaths occurred at the hospital. Does that mean the general hospital? And the other ones occurred in the community. Could you break down where in the community? Is that in just homes for the elderly or in people's private homes? And when someone passes in a private home, then what happens to that family or anyone that had contact? Is that part of the contact tracing in isolation system? And finally, have you established an ethics committee? Thank you.
Thank you for your questions, Nancy.
So just to give you a breakdown of the deaths, now the number reported for hospital, that includes Princess Royal, Princess Alice, and the General Hospital. In terms of the community, that includes persons who would have died in their home or at a care facility, right? So that is it. Now, most of the persons, right, in fact, almost all of the persons who were identified, right, they had a positive diagnosis before, right? So that family, or all the persons that were in direct contact with that individual, were ordered from before to self-isolate, right? And they were tested. So that was done beforehand.
Let me just add that as part of our standard procedure, our district medical officers that go out to certify the deaths at homes, they will ask for all the persons who die suddenly at home to do a test, all right? Do a test to verify whether that individual was COVID positive. If that individual was not identified before to be positive, all right? So they have an antigen test done at the time when the death is being certified.
Okay, Nancy, we also note your question on the ethics committee. I know you are reflecting on a comment that was made by the minister a couple of weeks ago. There has been no further progress on that to report at the moment. Up next, we have GBN. GBN, good morning to you.
Good morning, Rena Pierre Thomas, GBN. I have 3 to 4 questions, but my first question is, previously, around August 23rd, Minister Steele, you would have stated that there is a 30-day window for persons to get fully vaccinated during the rollout of Pfizer. Now, since we have not seen a new shipment of Pfizer, what would happen to persons who would have get vaccinated, let's say last week, and their second dose is next month, understanding that that 30-day window will expire by the 23rd of this month? My second question is relating to NADMA. Last year around this time, NADMA would have been activated already. We have seen more numbers now than previously last year. Why has NADMA not been activated? And do we hope to see this soon? And what sort of psychosocial support is given to families who would have lost their loved ones? And I'm talking about frontline workers, like the police, who have lost a lot of co-workers and stuff like that as well, and nurses, as well as persons in the homes.
With respect to your question on vaccinations, we constantly have vaccines coming in. So we will make sure that individuals have vaccines. In fact, our issue has been the opposite. We've had too much vaccines and not enough people coming. So yes, for sure, we will have vaccines available for any and all individuals who would like to be vaccinated. Your question with respect to NADMA has never been deactivated from when it was activated. So they continue to play an active role, a supportive role in various aspects of this response. And with respect to support, yes, that is of great concern to us. We have put certain contingency plans in place and have had these plans for quite some time, but each and every one of our entities, so the police themselves as well, they will have their supportive network. We do for our healthcare. We also have tapped into volunteers abroad who will assist with that counseling to give us that additional, it'll be a surge that exists right now for counseling. So yes, it is there. Whether it is enough or not, time will tell, which is why we recognize and we start most of our briefings with saying that and asking you all to keep the victims, the family of the victims, in our thoughts and prayers, because it's counseling and it's support. This is not just something that as a public we can just simply say that's for the Ministry of Health to handle again. One more thing for the Ministry of Health or the government to handle. This is us. This is our community. These are our loved ones. Yes, it's we have lost police officers, but these are sons and brothers and fathers of our community, and the community comes together as well. I do know that the force has its support network and has activated that for those that they have lost, but we need to also do our part.
Thank you, Minister. Linda Straker, you're next. Good morning to you.
Good morning to you and the panel. My question, I have quite a few, but I hope we could have a second round today. Yesterday, we would have seen the statement from the religious grouping and government with regard to the burial of persons who have died from whose death is described as COVID related. Now, one of the things is they have to be buried within 72 hours. Can the minister, as policy, tell us whether or not the government will be assisting persons who cannot afford to engage in that burial within the 72 hours, because there is a cost whether you're going to choose cremation or traditional burial? Is there assistance from government? My other question is with regard to the dashboard. We're seeing number of PCR tests, but we are not seeing a number of rapid tests. Can we get a breakdown as to the amount of rapid tests that has been conducted, especially during the weekends? And then the PCR test, does that number also include persons who are seeking clearance to travel to destination that require a negative PCR for entry into that country? Because the number seems to me to be quite bulk, and there is no breakdown, which is kind of may in some ways give a not clear, no clearance as to what is the true picture. There is still complaint of persons who are claiming that they are not getting results of the tests. Can Dr. Shawn or Dr. Myanna Charles tell us what is the person to do when they are waiting at least 9 days and cannot get a result? And in terms of, Dr. Shawn mentioned about the rum shops that are open. I quickly looked at the regulations, and it clearly said that there should be no consumption of alcohol, and any entity managers who allow this breach to occur can be subject to having the facility closed. Can the minister, Dr. Shawn, say which entity has the authority to close such a facility? I know the minister spoke about not closing because some of the shops are also village community shops that serve food and other groceries. Which entity has the authority to close such a facility in the event because of that type of breach? And my final question for now is the persons who have died, is there a breakdown as to the employment of these people? Because I realize it's a mix of persons, but I'm just wanting to see whether or not these are persons who are employed and working, and how much persons we are losing who are employed. Thank you.
Well, Linda, I think you went through about 3 rounds of questions there, but we'll attempt to get to them. Which
Let me
member
try
of the panel
first,
would
Linda.
like
You
to
asked about funeral support due to the time limit or so. There's always been, through social development, support for persons who cannot afford to pay for their funerals. There's a strict process in terms of qualification for that, but government always has tried as best as possible to give persons support. That would not change in this period. So those who qualify for that support would be eligible to get that support. With respect to, while I have the mic, you talked about rum shops and which entity would be responsible. It's the Royal Grenada Police Force that's responsible for enforcing of these regulations right now. Yes, the regulations say that alcohol is not supposed to be consumed on the premises, and obviously, based on the observations, that is not happening, that alcohol is being consumed on the property. I go back to, again, we need community to habits to change, and it's the very communities. I do not think it is totally fair under these circumstances, having had previous questions, the last question talking about the counseling support, etc., for the Royal Grenada Police Force members who have died or succumbed to this COVID-19, knowing that many of them, because they are part of our very communities, are also sick. For the rest of us just simply to say, well, that's for the police to handle. These are our neighborhood shops. These are our friends and families also too, and I think we need to do our part to stop this, because the individuals are going to be coming to our homes after frequenting the rum shops and infecting us, our loved ones. In terms of the demographic breakdown of individuals, if they are unemployed or employed, as Myanna Charles said, from infections are from 2 months all the way up to 103 years. Deaths are from people in homes who have never left these homes. Deaths are from frontline officers who were in the very same communities. We have community spread, and what we are saying is the ones we worry the most about are the ones who are unemployed, vulnerable at home, and the disease is being brought to them, because they're the ones that will die faster. They're the ones that are adding to the deaths at the hospital, as well as the deaths in our homes. But the ones who are positive are any and all of us who are non-compliant, whether you're working or not working. Dr. Charles?
Yeah. I wanted to speak about the rapid tests, and at least the person's not getting their results on time. Now, and it's a very good observation that you've made, that we report on the number of RT-PCRs, and RT means reverse transcriptase. I know I've heard it spoken of as rapid PCR. The RT means reverse transcriptase. So we have been reporting basically on the number of PCR tests were done, and these are done at our lab. And we have not the number that you see there reported on the dashboard does not include the number of rapid tests that were done. Now, we have been using rapid tests for quite some time. I am certain that we have done in excess of maybe 25,000 in the population. We have been using them routinely as point of care testing for quite some time. All right, we were not counting them towards the total number of tests that were done in the country. Once we had the establishment of community spread, we recognized that they became a more important tool in understanding the burden of the disease, or how many infections that are in different communities. All right, because the value of these tests increases as the number of positives in your community increases. All right, but we still did not add them to the total in the dashboard, but we use them as an important tool to rapidly identify positive cases in the community and to calculate the positivity in the community. We have recently had a discussion as to whether we should go back and add up all of these tests and include them in our testing or include them otherwise. That is a discussion that we're having, and of course they do contribute to the number of tests that are done in any country. But it's just that we were not routinely, or we have not added them as a test. I know that there are some countries that are simply reporting number of tests, and they include all tests done. But we have not done that yet. It's something that we're considering, and once we do, we would have to go back and look at all of those numbers that we put together, and we may be able to tell you more accurately the total number. But I'm certain that it's in excess of 25,000 rapid tests that we've done. Secondly, persons not getting their results on time. This is simply as a result of the fact that we are stretched. All right, we are stretched. The labs are doing more PCRs, and I think this is more a situation that occurs with the PCR tests. The labs are doing more PCR tests. All right, so when the tests are run, then all of it has to be entered into the lab information system before it's made available, and then you have to have persons who send these results out to everyone or to call everyone. Sometimes you don't have a contact for the individuals. So it's various factors. All right, but it is the result of us being overwhelmed, and it is something that has occurred in many other places. All right, when the labs become overwhelmed because they're doing a large volume of testing, there's a delay in the testing, and there's a delay in the results coming out, particularly to the persons who test negative. All right, especially for the persons who test negative, because you're rapidly trying to identify the positives and notify them. All right, but it is as a result of one of our systems that is responding to COVID being overwhelmed by large volumes.
Up next, we have Raul Patterson from Carriacou. Raul, good morning to you. Raul, are you still with us?
Are you hearing me? Are you hearing me?
With your questions, go ahead. Good morning.
Good morning, and good morning to, of course, everyone there. And I must say condolences, first of all, to the family and friends of Fatima Guadalupe. She's been laid to rest as I speak right now. And, of course, sympathies to all those who lost loved ones to this very vicious and invisible virus, COVID-19. My first question, actually, I was thinking of going into the rearview mirror, but I'm going to just go straight into it and sit down. We must form, of course, partnerships and alliances to fight this deadly virus. Having said that, I would like to know what are the new dispensation, what are the new policies that are in place to, of course, protect our senior citizens across Carriacou, Pitamatic, and, of course, throughout the country. Simply because we are seeing that, even as we speak right now, that's the vulnerable group in Carriacou and Pitamatic. That's our first death. And we are still seeing people from the geriatric department having to visit these people, rightly so. But, of course, I want to know if there's a policy in place to ensure that, of course, if these senior citizens are safe, when, of course, they are expecting and having visit from people from the geriatric department, who are the ones who normally ride the public buses and go through the community. That's my first question. Secondly, Carriacou, we only have one ambulance in Carriacou, and you will understand how stretched that is. Simply because you're having to deal with normal cases and now having to be confronted with an increasing number of COVID-19 persons. I would like to know if there are plans in place by the Ministry of Health to ensure that Carriacou has a second ambulance, because one ambulance having to deal with all these cases and having to sanitize and so forth, that in itself could create a serious problem for us in the near future. Hopefully not, but that could be. Skipping across to the sister of Pitamatic on the same subject, There is no government vehicle on the system of PT Martinique. And one wonders, down to yesterday, PT Martinique recorded the next COVID-19 case. Suppose someone needs to get to the health center, a COVID patient, or even get to the jetty to get the boat to come to Caracol, travel to the mainland. How would that individual get there? People with the few taxis and private transports not going to be allowing people who are COVID positive into the vehicles, and we all understand why. My other question is that, is it possible on your national COVID-19 dashboard that we could have a section for Caracol and PT Martinique in light of the fact that, of course, we have cases in Caracol, so we can, of course, we can keep account as to exactly how things are, hopefully not trending northwards, but southwards. My next question is that, well, actually a question and a comment really. We have seen in some countries, particularly that of Jamaica, where they are now faced with a challenge where some people are duplicating COVID-19 cards in terms of course, your vaccination cards. Are there any plans in place in this country in the near future? Because, of course, you know these things could spread, this fraud and so forth. Are there plans in place in the near future to maybe have these cards digitized so, of course, people's data can be better secured and cannot, of course, be tampered with? I have some more questions, but I think I'm just going to quarantine those for a while and we come back at the next one.
Roll for your questions. Just a point of housekeeping here to all journalists. I noticed it has happened with the last two reporters, about, I think, 6 or 7 questions fired off. Let's try to keep the questions to a minimum of 3. We have to be considerate of the other journalists who are waiting, and then we also have to be considerate of the panel. Unless you're specifically asked to go through all of the questions, please just ask 1 or 2 questions. Thank you very much.
Well, thank you for your questions. With respect to policy for senior citizens, there's been a policy, there's been a begging, there's been a pleading. There has not been a mandate. And that, I think, is what you may be implying. I personally have been involved in pleas and requests, my CMO as well, Dr. Charles, your parliamentary rep in Caracol and Petit Martinique, begging and pleading with individuals, and we communicated clearly to individuals, asking them please have their loved ones vaccinated in the homes because we needed their permission. We have government-run homes here that we got the individuals to be vaccinated. We have individuals out there, very responsible individuals who are working in managing homes for the aged and have done the responsible thing, the caring thing, and have gotten vaccinated themselves so that they can protect those that they're looking after. But when we do not utilize all of the tools available, we do end up putting our loved ones at risk. So I think what you're asking is if there's a mandate. No, there is not a mandate for vaccinations of persons in homes for the aged or those taken care of. But there has been a policy and a begging and a pleading to follow that policy, yes. Ambulance in Caracol. 2 things on that. It's not necessarily about the number of ambulances. I think what you were implying is that we should have 1 ambulance dedicated to COVID patients. Remember, COVID-19 is in the community. Persons who call for an ambulance call for various reasons. Some may be calling for symptoms that coincide with COVID-19. Others may be calling for other reasons. There is not going to be the ability for the ambulance driver or the hospital to make a determination as to whether the person is COVID positive or not. The assumption is that every person could be COVID positive, and therefore, as I am saying, the argument of having a separate vehicle or ambulance for COVID patients is not a practical one for implementation, because there isn't a practical way to guarantee or to ensure when responding to a call for ambulance that the response you're going to isn't a COVID positive patient. Separation of cases for Caracol on our dashboard or so, yes, we've received requests for that, and we will work with your team there. because I do see that someone in Carriacou is actually doing their own dashboard. I caution on that because it can cause confusion, but we will work with your team of in Carriacou and Petit Martinique, your representative there, and our community health response team there, to create some separate information for you for Carriacou and Petit Martinique. Vaccination cards we have had, and we do have an electronic version of the vaccination card that has a QR code. So it's not a case of a plan for that. That's already in effect.
Yes, I think there's also no mention. He had a question on the fact that there was no government vehicle in Petit Martinique.
In Petit Martinique. That I will have to check and see, but it's going to be a very difficult part of this whole response. Government vehicles, and yeah, I think you're implying specific to COVID-19 as well. There would be need for government vehicle for police, government vehicle for other medical response. So I think it is more, as Dr. Charles has said, Shawn Charles, and he can confirm this, it's putting protocols in place to allow the safe transport of individuals who are COVID positive by persons who would be volunteering, or by persons who have access to a government vehicle in Petit Martinique. Dr. Charles, I'm not sure if you want to add to that or so.
Yeah, I know that there have been concerns about this, but remember the basic measures that we have always try and explain what you need to do to avoid infection. One, individuals need to wear a mask. They need to sanitize. Now, with regards to vehicles, after someone uses a vehicle, even though they're COVID positive, that vehicle, the surfaces that were touched can simply be cleaned and disinfected, and that vehicle be made ready to use for whatever purpose. All right, cleaning and disinfecting is an effective way to prevent transmission by contact. You do not need, in all instances, to have a separate vehicle for COVID and for otherwise. You simply need to have the vehicle cleaned for after use. All right, and we must understand that when you are dealing with resource limited settings such as ours, you will not have all the resources that you want. All right, you will not have all the resources that you want to work with, but work with the science. All right, and that would limit the anxiety. All right, a COVID positive person can use the same vehicle as another person. You simply need to clean the surfaces that were touched, and that vehicle is safe for use by everyone else.
Okay, it is now 5 after, but we do have a number of journalists who have not had an opportunity to ask their questions yet. I will say to others who've indicated that they have follow-up questions, we would not be able to accommodate those this morning, but in the lineup for questions, we have Mikey Hutchinson, MTV, and Janisha Paul, before we bring a wrap on things this morning. So Mikey, good morning to you. Please go ahead.
All right, good morning to your panel. And my first question has to do with the policy on clearing persons who have tested positive for COVID-19. I'd like any of the doctors or the minister to please clarify that for us. And people who die from COVID-19, they need to be buried within 72 hours. In situations where families are not able to afford or have the resources to make that happen, what happens then? And finally, revaccination. I know that it is not recommended to take a vaccine too close to when you were tested or infected with COVID-19. What if you were infected and you were not aware and you took a vaccine? How does that affect the body?
Right. With regards to clearing from persons from isolation, I think we had touched on this previously. Now, the recommendation by both the Centers for Disease Control, WHO, for persons who are not symptomatic, they do not have symptoms, they can be, it's called transmission-based precautions, all right? Or they can be released from isolation once 10 days has passed. And for persons who have symptoms, it's 10 plus 3 days after symptoms have passed. Our policy is that these individuals are released 14 days after the date of confirmation of their positive test. Now, of course, there may be individuals that continue to have some symptoms after 14 days. I mean, there are a rare few individuals who may continue to maybe have a cough or something afterwards, and then those individuals, of course, they have to stay away for a little while longer until that resolves. Because of course, we do advise persons in the workplace that if you have flu-like symptoms, if you're coughing terribly, you have to stay away. But in any case, 14 days. Now, the science that explains this is that from research that has been conducted, the scientists have so far not been able to isolate viruses that are competent enough to go on to infect other persons after 10 days. All right, what that simply means is that after 10 days, the likelihood that you will go on to infect someone is very, very, very minimal. All right, we do so after 14 days, and that is the explanation behind the policy that after 14 days you can resume your activities.
I think there's also a question, CMO and Dr. Myanna Charles. What if you're infected, didn't know, and got vaccinated?
Right. So you got the vaccine, nothing may happen. All right. It has not been demonstrated that if you got the if you were vaccinated and you receive one dose of the vaccine, that it has caused any untoward or adverse effect on the individual receiving the vaccine. All right, so those individuals, if they discover that they have been infected, then we tell them, okay, you would have to wait. You would have to wait for some time, at least a month or more after you recover, to get your second shot. All right, so if you do discover that after receiving your first dose, you were infected with COVID, you just need to self-monitor, and then you have to wait until after recovery to get your second shot.
Thank you very much, Dr. Charles. And I think there was one other question from Mikey. What happens to those who are unable to afford a funeral within 72 hours?
Yeah, I thought I had addressed that previously. There is, through social development, support for persons who qualify for that support. That's a program that's been in existence for quite some time, not just for COVID. So individuals who do qualify for that. And I believe that question was also asked to the undertakers in yesterday's press briefing, and they too had suggested that through communication and verification, there may be some kind of process or so. But government has its social support or social safety net that has existed for many years, and then under these circumstances, there may be other arrangements and accommodations made by the undertakers.
Thank you, Minister. MTV, good morning to you. The floor is yours.
Yes, good morning. My question is as it relates to Carriacou. Could you give us an update as to the present situation in Carriacou? And also, could we see the contingent from the US and from Mexico providing assistance to the sister isle as well? Second question, with the decline in the positivity rate of individuals in Grenada, does this mean that we can soon see a flattening of the curve as well? That's my two questions. Thank you.
Thank you for your questions. Dr. Charles, CMO?
All right, so I have to admit I did not look at the numbers for Carriacou before coming here, because when we come, we speak nationally, and we include everyone, not. But I believe Carriacou, they have identified up to they had confirmed up to 90 cases. I know they've had a number of recoveries, and they've had one death. And of course, there were a few that were transferred to the mainland to receive care. So I mean, that is as much I can say for Carriacou at this point, because like I say, when we come here, we try to give the national picture and not necessarily considering Carriacou separate and apart from the national picture.
Okay, thank you very much. Nisha Paul, you're the final one for questions this morning. Can you please go ahead? Nisha, good morning.
Good morning, everyone. My first question is a follow-up to the new funeral guidelines. Yesterday, it was revealed that as an oversight, some spiritual groups, namely the Rastafarian community and the Jewish communities, were not included in the discussions that were held. What assurance can you give to these groups now that their concerns in this regard will be addressed in terms that they may have any requests for spiritual rights, etc.? And my second question is a request for an update on the nurses who would have been isolated after contracting the disease. Have they recovered? Have they returned to work? What is the status? Those are my two questions. Thank you.
Thank you very much, Nisha. I think with respect to the other religions, the statement made reference to other religious and various rights that accommodation will be given for. I don't know if Minister will want to speak any further on this.
Just to say that yes, I'm not aware of any religious rights from any of the groups that you mentioned that are not able to be accommodated in the new policies and procedures that came about in the meetings over the weekend and late last week, and that it was not a concerted effort or also to exclude them. It was an omission, but that we have catered for as best as possible. We welcome any communication from them to ensure that, but would like to keep it within that committee. And I have received confirmation that that committee, which is the religious representatives and the undertakers, as well as our Ministry of Health, have reached out to them as best as possible, have engaged them, and would ensure that their religious rights can be respected as well, while maintaining public health safety.
Okay.
No, as it relates to healthcare workers and their status with COVID-19, some of our healthcare workers, including nurses, have recovered and have returned to work, and we are really happy for that. And there are a few individuals that are still battling this deadly disease and are in isolation.
Dr. Charles, while you have the floor, I'll invite you to make any closing comments that you desire this morning.
All right, thank you. Now, we are seeing some encouraging signs, and this is evidenced by the decrease in the positivity rates, the increase in the number of recovered cases, the increase in the persons coming forward to get vaccinated. There has been a steady increase. It is not where we would like it to be because, again, our overall vaccine uptake is still low and we still have a lot of way to go, but it is encouraging. Also, an increase in compliance with public health regulations. Now, all of these are encouraging, and that is fueling the positivity rates, going down. But again, all of these things can be reversed if we get comfortable and we drop our guards. So I just want to encourage everyone, let's keep our guard up. Let's fight this disease together and we will overcome it. And there is some light at the end of the tunnel, but it takes all of us to play our part individually in stopping this pandemic. Thank you.
Thank you, Dr. Charles. Over now to Acting CMO, Dr. Charles, for his final thoughts, comments.
Well, in closing, I would just like to say that, we are not out of the woods yet. We still have a lot of work to do. Like I said, we are facing our first wave, really. All right, our first wave of any consequence. We just want the population to observe everyone around us is probably on their third. We can avoid getting there. All right, we can avoid getting there if we take the steps that we know have worked everywhere else. Vaccination has been proven to be effective at preventing severe disease and hospitalization and death. So we need to get our vaccination coverage up. All right, we do not know what other variants that may be brewing somewhere in the world and that will cause our second wave. But what we do know is that if we prepare ourselves, if we have good population coverage by vaccination, we can limit the impact of whatever variant or so that can come our way. And the safest and the least painless way to build, high level of immunity in your population is through vaccination. It's not by getting the disease, because that is the painful way. That is the painful way to build population immunity. The safest and the least painful way is by getting vaccinated. And of course, the other, we need to follow the measures that have been proven to work to prevent the spread of this disease. And that is by correctly wearing a mask when in the presence of others, by maintaining good hygiene, sanitizing, and by distancing and avoiding crowded settings where you do not necessarily need to be. All right? This is not a time to lime. All right? Because liming is one of the ways, especially when you do it in the presence of others and not observing the preventive measures. This is one way in which you spread the disease from person to person. We all have to be our brother's keeper in this one. That's the only way we're going to get out of it. Thank you.
Before we go to our Minister for his final comments, apparently there is an unanswered question relating to the flattening of the curve based on the reduction in the positivity rate. CMO, would you take that?
Right. Now, I don't want to convey a false sense of that we are over the hill and it's all going to be good. We do our best to control and to prevent this pandemic. There will come a time when the disease has reached every susceptible person, and then the only way is down. But that is until the next variant or so. So yes, the signs point to us arriving at a point where the number of cases may soon be less. In fact, we are seeing signs, but this is not a time to celebrate. This is a time to be cautious and to continue to ensure that those signs are actually correct, and that is not, So we encourage everyone to continue to follow the protocols, and like I say, we need to build our vaccination coverage. That is the only way we're going to be comfortable. All right, and that's the best way we'll be able to face the next variant and the next wave, if it does appear. Thanks.
I think, Dr. Charles, the concern was that maybe persons were alarmed when I think you sounded the alarm that we could reach 50% of the population in a matter of weeks. I know you're erring on the side of caution and not wanting persons to become complacent, but do you still see that as an immediate possibility?
Yes, it is a possibility. Remember, we are dealing with a highly contagious variant that is still spreading in our communities. So that still remains a very real possibility.
Thank you, Dr. Charles. And Minister, the final thoughts of the morning are yours.
Yes, thank you. Let me say that with Dr. Charles, both Dr. Charles, our community health nursing team, community health team in general, our DMOs, those at Morris Bishop International Airport, our wardens, etc. For the past 15 months, we've been able to keep this disease at bay. We haven't had a single wave, while every single country around us, and if not all countries in the world, have had one or two and possibly on their third or fourth wave of this pandemic. That put us into a position that we valued, each and every one of us in Grenada. It put us into a position where we felt safe, but it also made us complacent. And I know from the questioning about flattening the curve, and I think that is the point that Dr. Shawn Charles would like to stress on the most, and I want to spend some time on it as well. If we do not get to the level of vaccination, and if we start marking our successes with a flattening and a reduction on the other side, and go back to the ways of old, that is the ways of August, we'll be right there again with a second wave, a spectacular second wave. We had a spectacular first wave because it was the most deadly and contagious variant of this virus to date. And also, we had a spectacular period of celebration, so it allowed it to spread. We've moved on from that, but we must not forget that. It's not about blame. It's just for us to remember what got us here. Part of what got us here is the success. Because part of that success had each and every one of us feeling comfortable. And part of what got us here was also the complacency from that success. And taking for granted that we were invincible, or that the government would be able to handle it, or the government, all it needs is a government policy. It's not a government policy that will get us through this and keep us past or prevent us from having this happen again. It's not a government policy. It's going to be a community change in habits. If we don't have that, there is no policy, there's no regulation, there's no ministry that can prevent this from happening again. So we just need to acknowledge and recognize that. When we look at our first world neighbors and those of us, members of our diaspora who are in those countries, US, UK, etc., they can attest to the fact that based on the states that they're in and the level of vaccination, that activities are almost back to normal with certain protocols in place. And that's where we want to get to. That's where we need to get to. That's where we must get to. So between now and then, we need to make the necessary adjustments in our community habits. And that may not be us personally, but make sure those that we interact with also make those adjustments in their community habits. We need to get our friends and loved ones vaccinated. And we need to recognize that while we have lost, each and every one of us probably knows of somebody, either very close to us or somebody that we know or have interacted with, who may have passed away as a result of this wave. We don't want that to continue. We need you to work with us to minimize the hospitalizations. We need you to work with us to minimize the deaths. We need you to work with us to get people to be vaccinated. And finally, we need you to work with us in uniting on this mission, because there still are some individuals out there that are exerting all of their efforts and energies to discredit the very health team here and RGPF and others. And now is not the time for that. It serves no true benefit. There will be time afterwards to judge, and there will be time once we're back to normal for us to go back to pelting stones at each other, if that's what we have to resort to. But right now, those who are choosing to discredit, send misinformation under the guise of breaking a story first, without checking, or purposely twisting a story to suit an own personal vendetta. So that has to stop, please. That has to stop. We pick that up on the other side of this curve, if that's what you have to do. But we need unity now. We need our communities together. We need our communities working with our community health nurse, our community health teams, our DMOs, etc. We need to fight COVID-19. So I'm making that call to the communities for us to find a certain level of unity. It is truly, truly a matter of pride where we see the volunteers coming forward. Dr. Charles, Dr. Myanna Charles, Dr. Shawn Charles, myself, we've been on the front lines weekday and weekends. But seeing members of the community coming out, their own communities, to make a difference in their own communities, for vaccination, for testing, it really is what we need to do. And I want to recognize all of those who are doing it and encourage others to come forward and do their part. This is not going to be one of those occasions where we can sit on as bystanders and just be commentators on it. We actually do need to all get actively involved to keep us all and our loved ones safe. Thank you. Thanks again always to our frontline workers who continue to provide human service to us all, who themselves may be afflicted or have lost loved ones or co-workers. And thanks to those who have been giving us support in the diaspora and even further afield, who have no connection or no loved one in this country but have come all the way from Mexico to Grenada to put themselves at risk to help us get past that. We need to recognize them and thank them as well, and keep those who have lost loved ones and those who are right now dealing with the pain and tremendous discomfort and worry while they are positive. Keep them all in our thoughts and prayers. Thank you.
Thank you very much, Minister, for those closing comments. And with that, we come to the end of this week's post-cabinet press briefing. I am Press Secretary Philomena Robertson. Thank you so much for joining us. We'll see you again next time.